that we keep our fellow San Diegans safe. Public health officials, as I'm sure you know, have been telling us that the worst of the COVID-19 hasn't hit us yet in this region. They're saying, of course, that the storm is still out there and on the horizon, which is why it was critically important that we are doing everything we can now to make sure that no San Diegan is left behind, particularly our most vulnerable. So I know that many out there who are at home are eager to help, and we will be putting out a call for donations in the coming days. But at this time, I would ask people not to bring anything down here to Golden Hall until we have announced more specific needs and locations for that drop-off. This is a united effort. Again, I can't thank all of the folks that are part of this system, our ecosystem, with one goal. How are we going to help people? And how are we going to help them immediately? Now I'd like to introduce someone who's been a true partner with all of these efforts between the city and the county, Supervisor Nathan Fletcher. Supervisor, thank you.
Thank you, Mayor Faulconer, and a special thank you to everyone who's here today. The efforts that have been taken really have been collaborative. We're incredibly grateful for the Regional Task Force on the Homeless, led by Councilmember Chris Ward, along with our tremendous state allies we have with us here. Obviously, Senate Pro Tem President Tony Atkins, Assemblymember Todd Gloria, and other state leaders have been instrumental partners and vital. And most importantly, a thank you to our providers, those who are out there every single day providing the help and care and assistance to serve the vulnerable population, the homeless providers. We are incredibly grateful and appreciative for the heroic work that you do every day and the work that you do in a much more difficult environment and what we are going through right now, and so we're grateful. The actions that are being taken in coordination with all jurisdictions and all entities together are designed as best we can to create a seamless process, a process that allows us to first identify any unsheltered individual who has symptoms and immediately get them into isolation with the appropriate level of care and resources that they need to get through that. Second to that, we want to make sure that any vulnerable population who is particularly acute, those seniors, those with underlying health conditions, we want to make sure that they also get in isolation and get the appropriate level of care. And then for everyone else, we want to make sure that they're in a sheltered environment with the appropriate social distancing, the appropriate hygiene, the appropriate hand washing, the appropriate access to public health nurses, the appropriate food supplies. And all of those are designed to try and prevent a mass outbreak and make sure we're in a position to deliver care. And the actions that are being taken, all of them collectively, are designed to help us achieve this end. To date, in addition to the regular efforts that have been done, we have installed 257 hand washing stations throughout San Diego County. As I was walking in today, I saw one of them that is being refilled. We will continue to monitor their usage and refill them. We are also in the process of placing new ones as we get requests for additional ones. We've deployed public health nurses to currently nine shelters across San Diego County. These public health nurses, they're there to assess all of the residents and folks who are in those places, look for symptoms, and if they have symptoms, to get them into a motel room. We also have public health nurses with hot teams throughout San Diego County in all jurisdictions. So far, they have delivered 490 hygiene kits. They have 500 more that are in the process of being deployed, and we have 1,000 that are being assembled as we speak. The County of San Diego, in partnership with others, has now secured 1,954 hotel and motel rooms. Again, the largest grouping of these are public health rooms that are designed for individuals who have a positive test or a person under investigation. As our testing continues to increase, we are anticipating a significant jump in the coming weeks in the number of positive cases, and we need to have those rooms available when that jump happens for individuals who cannot isolate at home. We have currently allocated 200 rooms to the Regional Task Force on Homeless. They will fill those rooms with homeless individuals who are particularly vulnerable via age or underlying health condition, and we are working with them to acquire more of what we would consider the RTFH portion of those rooms. The efforts around Golden Hall are particularly helpful, and the efforts of moving forward on the convention center are particularly helpful because it allows us to ensure social distancing in all of our shelter capacities and to begin to move towards that where we can ensure social distancing and we can move people to the appropriate level of care and then begin to have an avenue and a pathway responsibly for more individuals who are currently unsheltered to get sheltered, but do it in the right way. And so the combination and the interaction of the city, of the county, of the state, of our providers, the Housing Commission, which has been an incredible asset and partner, and most particularly in an effort to support our frontline providers who are out there every day, is what is helping us be able to try and pull together and build together a system of care that will appropriately serve the needs of the folks in these ever-changing and difficult times. And so I'm here in great support of what's happening here at Golden Hall and very excited and encouraged by what we're moving forward with at the Convention Center. As it relates to the Convention Center, our public health, mental health, and behavioral health teams are fully integrated so that we can ensure we are providing all available services to these individuals should they arrive at that location in hopes of helping improve their condition. So again, we appreciate the mayor and everyone involved, and we will all continue to move forward together. Thank you.
Thank you, Supervisor. Next, I'd like to introduce Senate President Pro Tem Tony Atkins, who, as I think many of you know, has been engaged from the state level, really helping our region have the resources that we need. Senator Atkins was instrumental in day one from all of the dollars we've gotten from homeless services and in making sure that we're getting even more. So Senator Atkins, thank you for everything you're doing on the state level.
Well, good morning. I am pleased to be here this morning with Assemblymember Todd Gloria. I want to say, as the Senate leader, I've had frequent and communication with Governor Newsom on a daily basis as late as this morning. Last week, you are probably aware, the legislature approved $1.1 billion in authority for the governor to enact emergency declaration and needs associated with that, of which $100 million in new emergency COVID-19 homeless resources. The city of San Diego got $3.7 million of that, the county $1.64 million, the regional task force on homelessness $1.79 million, for about $7.13 million, and that's on top of the $43 million from last year's budget, which should be going out soon. I want to make sure that you know that my focus, in addition to the responsibility I have with 38 other senators statewide, is also going to be to ensure that San Diego is receiving necessary supplies and resources as the governor works with his team to secure those needed resources and supplies in his work with the federal government. I do have to acknowledge and say an incredible thank you to this team effort, Mayor Faulkner and his team, Supervisor Fletcher, the county, their team, Public Health, Nick Machione, the Regional Task Force on the Homeless, and Tamara Kohler and her team. You notice I keep saying and their teams. There are a lot of people working very hard around the clock to make this possible. The Housing Commission has already been mentioned, Rick Gentry and his team, and the incredible Convention Center who stepped forward at this time with his team, the vendors, the employees, to provide space so that we can do it in this way that monitors people with the social and physical distancing needed to address the concern. Rip, you mentioned the CEO, but his team and the board made it possible for us to have this available. I want to make sure that you know that all of our legislative offices are open for questions remotely. Our staff are working remotely. We are responding to calls. If you get a voicemail, please leave your name and number. We will call you back. We want to make sure that you're updated, along with the messages that you're getting daily, weekly from the governor and from local government, as I've seen. We want to make sure you have the most updated information and the resources for the constituents and the citizens of San Diego. And finally, I do want to thank all of the businesses and the individuals that are working very hard to adjust to the ever-changing situation we find ourselves in, to the social service providers that are here and critical, and to all those who want to volunteer and find a way to be part of this. I want to say thank you. The San Diego leaders are amazing in their collaborative effort that we have put together in the past days and in the past weeks to make a very good collective use of all of the resources. That money that I talked to you about a minute ago, they are working collaboratively together to use those resources that we are getting as efficiently as possible. And I have to tell you, this is an integration like I haven't seen. And it is to the mayor and to the county supervisors and certainly to the agencies that have a responsibility to provide these services. I haven't seen this kind of collaboration, I think, and I can say this to my colleague, Mayor Faulkner, not since 2003, 2007, the devastating fires in San Diego, or even since 9/11. When a community comes together, we can do this. If we come together, we can make sure our community is safe, and we can make sure that the most vulnerable in our community are also safe. So I'm counting on all of you to follow our state and local guidelines, to look out for each other in this time. And I want you to know we will continue to respond and work together for the greater good, not only of our San Diego community, but of our state and our nation. Thank you.
Thank you, Senator Atkins, for those words and your constant help and support for the region. As I said, this has been a real team effort. Next, I want to welcome the council member for this district and who's chair of the Regional Task Force on the Homeless, Council Member Chris Ward, who's him and his team have been jumping in with both feet since day one. Council member.
Great. Well, thank you, Mayor Faulkner. And as the council member for the 3rd District and the chair of the Regional Task Force on the Homeless, I can truly say that I see this crisis that we're all experiencing as an opportunity to be able to help more homeless individuals and be able to do so in the right way. The steps that we're taking today will accelerate the process of identifying and securing safe spaces for homeless San Diegans in line with the critical actions that we're all taking to protect each other. By expanding Golden Hall and opening the doors of the convention center to those experiencing homelessness, we are giving our most vulnerable neighbors the opportunities to be indoors, wash their hands, and maintain a safe distance from others, the basic practices that we all must undertake to stop the spread of COVID-19. Including the ongoing placement of homeless seniors in hotels, our response must meet the need on the streets and in our shelters. And this collaborative, thoughtful, and deliberative approach will save lives. There are a number of people making these actions possible, and I want to specifically thank Tamara Kohler, our CEO for the Regional Task Force on the Homeless, and all of her team for being able to work diligently around the clock over the weekend to make sure that we can have these opportunities come to life. The RTFH has used all available tools and resources in leading our efforts to protect homeless individuals throughout San Diego County from the coronavirus. These are substantial but necessary actions that are just getting underway. And as those steps develop, I want to say thank you to the city, county, Housing Commission, and RTFH staff that have been working nonstop on coordinated COVID response. I also want to thank our providers and our frontline staff that are not giving up, but are meeting the challenges of today to help those in need. You are truly stepping up, and we're grateful. Today's actions are the product of ingenuity, collaboration, and compassion for homeless San Diegans, and we will continue to meet their needs as we navigate and overcome this crisis. Thank you.
Thank you, Councilmember. And next to talk about this approach and who will be helping to quarterback this with all of these different changes that we are moving on quickly is Tamara Kohler, who is the CEO of the Regional Task Force on the Homeless. And one of the reasons that we are so grateful for Tamara's help and support, this is a regional effort. This is a City of San Diego effort, and this is a regional effort throughout the rest of the county. Tamara?
Thank you, Mayor, and good morning. This is truly a time for us as a region, for us as people, and for us as, thank you. For us as a region, for us as people, and for us as leaders. It is unprecedented to see this many leaders come together with a singular purpose, such dedication with action. It's an unprecedented time for our homeless response system as well. Individuals experiencing homelessness in San Diego are more susceptible to the serious complications of COVID-19 than most populations. Many are aging and many have underlying health conditions. This is why our actions that we're announcing today are so important. We are creating additional, more appropriate spaces to serve the individuals and families experiencing homelessness at this unique time. We are also implementing new processes to swiftly isolate individuals exhibiting symptoms of respiratory illnesses. And as early as tomorrow, we will begin the process of moving all of our families in the bridge shelter located in the upper level of Golden Hall into motel rooms that the county and the regional task force have secured. The next step will be the transition of our single women from the city-funded shelters to this large space here on the lower level of Golden Hall. These actions importantly support the additional physical distancing among shelter residents, which we know is essential to preventing the spread of COVID-19. As soon as the convention center is online, we will transition individuals from most of our city shelters into the facility in phases. This will allow us to repurpose our current sites to address screening, intake, and triage for individuals coming off the streets. This is an incredibly intentional and deliberate approach, with the intention of ensuring individuals whose needs to be referred to isolation options are routed to those service points, and persons who are routed to the convention center have been appropriately screened to promote a health and safe environment. I want to take a moment to point out that even in this new process, with a new process in place, under the county's guidance, an individual exhibiting symptoms who is at greater risk of exposure or is part of a vulnerable population will continue to be placed in those motel rooms when appropriate. This is truly, as the mayor said, a regional effort, and it is our goal to provide safe, adequate shelter for our entire homeless population. The Regional Task Force and the leadership of the San Diego Housing Commission, along with the county and city leaders, are working to identify needs, supplies for the shelter of these individuals. As the mayor said, we are not looking for donations at this time, but when the time comes, we hope that people act. This goal will provide the recommended distancing of individuals in shelter, critical to flattening the curve, and hopefully we have homeless individuals who never experience this virus, and that we ensure that we have adequate staffing as well. While we are rebuilding our homeless crisis response system to address the unprecedented circumstances we're experiencing because of COVID-19, this group gathered here today reflects the depth and breadth and strength of the leadership and commitment to collaboration and communication that will carry us through these circumstances. I want to thank all of our partners, our leaders, those who run the emergency services and shelters, and especially to our homeless population for their courage and willingness to work with us as we try to meet their needs during these challenging times. Thank you.
We'll have you stand close by in case we have some questions. Thank you, Tamara. As I said before, and it's been mentioned, we are very fortunate in this region to have some of the best providers throughout the state and throughout the country. Again, I want to thank some of our providers who are here that will be available to answer any questions. Bob McElroy. Bob, to you and your team of Alpha, thank you, my friend. You continue to do phenomenal work, and you're saving lives every day. Deacon Jim Vargas of Father Joe St. Vincent Paul. Deacon, thank you. To have your leadership is phenomenal. This is a very, this is challenging, but yet the fact that we've had everybody that said we need to jump in with both feet and do this and do it now, I think represents the best of our region. To all of my colleagues who are here as well, thank you for your regional approach. There's a lot of work to do. We have been working nonstop over the last several days, and this will continue to the foreseeable future. With that, I will pause and be happy to answer any questions or turn it over to somebody, any of our speakers or any of our providers that are here to answer any specific questions that you may have. Thank you.
We do have a number of questions that have come in via our text messaging system from news outlets.
Thank you.
I'm going to start with one question from Anjali from KUSI. We would like to know, given the attempts at enforcing social distancing and limiting group gatherings, why are our city officials continuing to congregate together in one room for these meetings?
Yeah, no, thank you. I appreciate that from our friends there. It's important that everybody maintain social distancing, including city officials who are here practicing that as well, and also being able to be receptive to the media to give you the answers and the specific questions that you need, particularly on a topic that is so varied and difficult. But that is incredibly important for everybody to model that social distancing and to do that social distancing. Thank you for the question.
One question from Kathleen Ronayne at AP. I'd like to clarify if the 1,900 rooms are for homeless, or so far only 200 for homeless and the rest for others needing
Turn that
isolation.
over to Tamara or Supervisor Fletcher, who will give us an update on the number of rooms that we have and how we're putting those out.
The rooms that we're reporting out fall into two categories. One are public health rooms. Those rooms are available to homeless who have a positive test or a person under investigation. They're also available to anyone else who has a positive test or is a person under investigation who does not have the availability of self-isolating. So those rooms are available to homeless, but it is not exclusive for them. But those are limited to positive tests or persons under investigation. The other category of rooms that we are continuing to increase, and we will continue to allocate more and continue to gain more, are for homeless individuals, but only those who are at the age or underlying health conditions we've identified as being most vulnerable. And then each of those categories of rooms are equipped with food, with janitorial, with cleaning, with wellness checks, along with security at those individual facilities.
Next question comes.
And I also want to
oh,
add
sorry.
just on the issue of the number of rooms. Again, thank you to our private sector partners. I can't say how many hotels and others that have stepped up and said, we're happy to help with that desire for more rooms. And I think that reflects the spirit that we've been looking for. Please go ahead.
Next question comes from Gary Worth at the Union Tribune asking, will the enforcement of any ordinances affecting homeless people be temporarily suspended? These would include encroachment, encampments, vehicle habitation, and oversized vehicle laws.
Yeah, no, good question. I think that what we are all working for is, it's not about an enforcement mechanism. It's about how do we give people a bed and a roof over their head at a scale that has never been done before in San Diego. And so not only with the bridge shelters that we've done, but with Golden Hall, with the convention center. And we've been talking about this a lot with some of our providers and our housing commission and others. Some of the folks that are on the street have started to lose some of their support networks in terms of food, ability to charge, a variety of different things. They need help and support. They need a place to go. We have never been able to offer the number of beds that we're talking about offering that's ever been done in San Diego. This is the right thing to do. And so our approach is going to be one of encouragement. Our approach is going to be one of our foot teams that are going to be going out to continue to say, we have a bed for you. We need you to come inside. And I'm very confident that we are going to see the utilization of this dramatically grow, just like we did when we opened our bridge shelters. The fact that we had the capacity that we had at our bridge shelters, when we put one up, we put another one up and another one up, shows the need. And I think that's one of the reasons why San Diego County continues to be a leader in providing help, providing services to do the right thing. And so I'm confident that this will be a real game changer when it comes to the utilization of folks saying being on the street is not something for them. Being inside in a safe, secure environment is what they need to do.
Next question comes from Andrew Bowen at KPBS. How many new beds will be available between Golden Hall and the Convention Center? Will they be mainly for people who are currently unsheltered or for people who are in shelters that are too crowded to allow social distancing?
Yeah, great. I'll have Tamara come back and reiterate that. Again, what we have here in terms of numbers of beds right now in Golden Hall, several hundred. The Convention Center is going to be designed to scale. And so as we open that up in the coming days and weeks, we will start with X, and we will be available to quickly grow to Y based on the need. But Tamara, do you want to come and talk to some specifics?
I feel like the mayor said it really well. Our goal with the convention center is to be able to scale. So our first approach will be able to bring those that we have known for a period of time that are well and not exhibiting symptoms, who are in our shelters where social distancing is our challenge. Those will be the first groups that we bring into the convention center. And then we will scale that convention center to whatever the need may be. As we had said in our goal is that everyone who is unsheltered should have an opportunity to be able to come in and receive services, simple things like charging their phones, meals, showers, bathrooms. This is being built to scale with not only the incredible support of the convention center, but also our providers and our behavioral health and our healthcare experts, so that it is set up very intentionally to meet their needs not only of shelter, but of socialness and inclusion, and we will have our ACT teams there. It is standing up a city really within the convention center.
Thank you, Tamara. Other questions?
Next question comes from Cody Delaney at iNews Source. He did ask about the beds. I believe that's been covered. His other question is there a date on when that will be open for the homeless?
Golden Hall will be open later this week. We will give a time for the opening of the convention center. As I said, the walkthroughs happened over the weekend. The logistics is already being planned in terms of showers, restrooms, all of that with the team. And so we'll give announcements on when that can be up and running. But the movement to allow social distancing of our shelters, including upstairs for our families and women and children, will begin this week here at Golden Hall.
And we have two reporters here in the audience. If you'd like to step up and ask a question, now's your time.
Yeah, please.
Obviously, you guys are talking about these hotel rooms and putting people who are homeless who may test positive in one of these hotel rooms. That being said, you guys are obviously preparing for people who are homeless to test positive. Have you seen any people who are homeless yet test positive? Like, do we know if the virus is spreading in our homeless community here?
I believe the answer is no at this point. And again, I can't think enough why we move so quickly. We're going to continue those tests. To have our public health nurses that are out there in terms of temperatures, symptoms, other. The goal is that if somebody is exhibiting symptoms, that they are removed quickly, immediately, not in symptoms and folks that are persons of interest. So at this point, no, but this is something that we are planning for to try to do our best to get the most vulnerable in the best situation that they need to be in.
Gotcha. And I know just after I tweeted out a video of this, somebody said that it looks like this is an area where like the virus could spread with these beds like this. I mean, do we know if that's the case?
Yeah, no, and again, we're going to have all of our public health professionals here. It's about being 6 feet away for everybody who is here. This is not the setup that you're going to see once we do it, but again, everything's moving very, very quickly in terms of how it's going to be set up. You see the cots here today. Obviously, the mattresses are coming, all of the setup. The idea is how do we move quickly, get that physical distancing, but also provide all the other help, support, the wraparound services that we have to make sure that everybody's going to be cared for. Yeah.
So I'm hearing a lot of confusion and panic from unsheltered people, both in the city of San Diego and throughout the county. And so I would ask all the folks here, how is the word getting out to people about accessing these resources, and how do they access them? Because there's been just a massive amount of confusion and fear, frankly.
No, and I'll tell you, Lisa, that's why we're here today. That's why we need all your help and support. All the word that's going to get out from our providers and our provider teams. Again, the network that we already have established. Our foot teams that are out there every single day are going to be saying, here's the service that's available to you that wasn't available a week before. We are talking about increasing the supply of beds that, as we've said, has never been done at this scale in our region before. That word will get out quickly. We will continue to use the media. We will continue to use our providers network, our foot teams, and others with one goals to let folks know we have a place for you. It's time to come inside. It's all about helping people get through this. And that's why we're moving so quickly, state, county, city, all of our providers together. I'm confident we're going to really start to change the dynamic of that when it comes to availability, which we haven't had before.
Now, maybe this is a question for Tamara, since she referenced this earlier, but you mentioned that the bridge shelters would be screening locations. Does this mean that unsheltered people can show up at the bridge shelters and potentially be connected with some sort of help?
So that is our intent. Currently, the bridge shelters have people that come to them or come from their outreach teams, and our shelters are primarily full most of the time. So this is a process that they are skilled at. They know how to meet with them, assess their belongings, their wellness. This is one of their real talents of that team. And as we move people from the shelters into the larger convention center, they are the best points of interaction, and I would look to Bob and Deacon Jim to really stress that. These are the right entry points into larger shelter opportunities, but it also is the place where we'll do the health screening as well. So we want to meet their immediate needs. We want to give them a clear path to shelter. And we also know that these are the experts in the field, are those that we have at those points of intersect at the bridge shelters.
And I think another thing people might wonder is how long will these opportunities be available, and what's the plan for people? You know, obviously you're creating more capacity where people can come in.
Yep.
Is there a plan to get people somewhere else after this crisis?
We're already looking at that. It's a great question. We're spending some time on the exit strategy, I think, to your point, Lisa, which is we want everybody to come inside. We want to get everybody safe. But we're also spending time looking ahead to when we get on the other side of this, and we will, in terms of housing opportunities to get those wraparound services, all the things that we're going to need to do once we get everybody inside. That is something we're looking forward to at a larger scale than we've never been able to do. But that planning is happening simultaneously while we're trying to get as many people as we can off the streets.
We have one final question that came in from Bianca Bruno at Courthouse News. Where will people who live in their vehicles and park RV vehicles at beaches and public parking lots be able to park their vehicles in light of the closure of the current parking lots?
We still have our safe parking lots are open. We have capacity. Those services are ongoing. We have not only wraparound services and help support, housing support at all of our safe parking lots. We will continue to provide that. We want people to use them. We have capacity, and we will continue to monitor that on a daily basis. Yeah, and Supervisor Fletcher, one more cut.
Sorry, one thing I forgot to mention earlier that's important. We have a lot of unsheltered individuals who are in hospitals who are physically ready for discharge, but they don't have a location to go to. And so the hospitals are reluctant to discharge them. By increasing our capacity, our sheltering capacity in socially distanced ways, we also have the ability to free up vital hospital room capacity that would be needed for individuals who might be seeking care there. So the efforts that we're taking both with Golden Hall and the Convention Center also have an impact on raising that dotted line on our hospital capacity by having an appropriate level of discharge facility for them. So that's another way that the efforts we're taking are helpful in the broader system.
Thank you. Appreciate everybody's attendance today. Anybody will be available for any questions one-on-one. Thank you.